Today I'm going to be talking to you guys about Gorham-Stout, or the vanishing bone disease. So Gorham-Stout is also commonly referred to as just GSD, and it's a bone disorder characterized by progressive bone loss and the proliferation or overgrowth of lymphatic vessels. So as you can see in this picture, the lymphatic vessels have dilated and multiplied so immensely that they're actually beginning to break down the bones in the shoulder region. As a result, the patient could have severe functional impairment. So this disease can be seen among any age group, but it's most likely discovered within children and young adults. And it's also an extremely rare disease, and by that I mean like fewer than 200 cases have been reported since 1838, when it was first discovered by Dr. Gorham and Dr. Stout, hence the name Gorham-Stout disease. So they've had over 200 years to further their research into this topic, but yet the cause is unknown. While there is no link to it being caused by any hereditary or environmental factors, many research studies and theories suggest that it could be caused by abnormalities in blood circulation or a shift in the ratio of bone generating to bone destroying cells, which could be triggered by trauma. So Gorham-Stout disease usually only affects a specific region of the body, and the most commonly affected areas are the ribs, spine, pelvis, skull, clavicle, shoulders, and the jaw. However, in some rare cases, it may affect multiple bones throughout the body. For example, these x-rays were taken of a 5-year-old girl, and they revealed that she had Gorham-Stout disease in numerous parts of her body. X-ray A here shows that she had osteolysis of her left and right ribs, her clavicle, scapula, and her lumbar vertebrae. X-ray B shows that her ilium, sacrum, and femur were beginning to break down. And X-ray C and D are particularly interesting because D is actually an X-ray of her left leg, which was not affected by the disease at all. And as you can see in X-ray C, her right tibia was severely affected. So it really helps in highlighting the drastic effects that Gorham-Stout can have on the human body. So when someone is diagnosed with Gorham-Stout, there are some general symptoms that they may experience, including pain, swelling, and spontaneous fractures. However, depending on the area of the body that's affected, these symptoms may vary. For example, if the thoracic region was affected, the patient may experience chest pain, difficulty breathing, and weight loss. If the spinal cord or skull were affected, they may have spinal pain, they may get paralyzed, or have cerebral spinal fluid leaks. And last but not least, if the jawbone is affected, they might get jaw pain, they might have loose teeth, or facial deformity. So once someone is diagnosed with this disease, there's many different paths you can take throughout the body, and it all depends on the success rate of the treatment, which I'll be discussing in the next slide. So if the treatment is successful, either remission could occur or the progression of the disease could stabilize over a few years. However, if the treatment is unsuccessful, usually GSD could be fatal if the chest area was affected, or it could cause neurological complications if the spinal cord or skull were affected. But regardless of how successful the treatment was, the patient will ultimately end up with severe deformity and functional disability. So these x-rays here are actually a perfect example of how GSD progresses once it's contracted. So these are taken of a 15-year-old girl over just a 6-month period, and you can see just how rapidly the bones began to deteriorate in her shoulders. Now, thankfully for her, the treatment was very successful, and the deterioration of the bone did slow over time. But she still continued to complain of pain and poor function. But with any disease, treatment is always advised, and especially for this one, it's highly advised. And the treatment plan differs from patient to patient, and it really depends on the area located and the severity and any complications that could have occurred while they had it. So the go-to treatment plan that many doctors choose is medication and drug therapy. And that's because advancements in medicines have allowed drugs like antivascular and immunosuppressive drugs like rapamycin and biphosphonates to actually slow or sometimes even reverse the damaging effects of GSD. However, in some severe cases, the bone might have deteriorated so much that it basically lost all its function. So in that case, they go to surgery, in which they physically remove the bone and usually replace it with an implant. So radiation therapy is also another option that doctors have, but that's rarely used due to the horrible side effects it can have on the patient. So typically, Gorham-Stout disease is an extremely rare bone disease, and it's caused by the overgrowth of lymphatic vessels that ultimately deteriorate the bones. And while today there is no known cause or cure for the disease, hopefully with our advancements in medicine and technology, we'll be able to discover the cure and cause. Any questions?
What are lymphatic vessels?
So that's basically like a vessel and it carries the lymph, which is like a colorless liquid that holds the white blood cells.
Are there any like hereditary aspects to it? Like if a parent had it, would their kid get it? Or
Yeah, no, it's not linked to, there's like no hereditary links with it at all.
How does radiation therapy help?
So, I mean, it's basically like it could like kill off the cells or the lymphatic vessels that are overgrown. Because they're basically white blood cells, so it's kind of like leukemia. They're just like, yeah.
So you said there weren't like causes like for this disease, but like what would you like if there was one, what would you think it would be?
I personally think it could be the shift in ratio of like bone destroying to bone producing cells, which are like osteoclasts and osteoblasts. Because like the perfect ratio allows for them to maintain their bone mass, but if the bone destroying cells are beginning to multiply faster than the bone generating cells, obviously the bones are gonna begin to break down.
do you know the survival rate?
Usually everyone survives